Okay, so the next skill that I'm going to show you guys how to do on your patient here is a partial bed bath, okay? For the test, you're not doing a full body bed bath, you're doing just a partial one, okay? So, the way I like to remember this, because there's a lot of little supplies that you have to get, is the number 62. 6 washcloths and 2 towels, okay? Gloves are optional for this skill, so don't worry about wearing them. So here we go. We're going to knock in and then introduce to our patient. So knock, knock, knock. Good morning, Mrs. Jones. How are we doing today? She's going to respond back that she's doing fine. My name is Michael, and I'm going to be your CNA today. And I'm going to go ahead and give you a partial bed bath. Is that okay? She says that that's fine. So just give me a moment here, and I'm just going to close your curtain for privacy and perform hand hygiene. I'm going to close the curtain for privacy, hand hygiene. Okay? So first, what you want to do is go ahead and get your chucks, because this is going to be the barrier that's going to keep everything nice and clean for you. Okay? Then you're going to go ahead and grab your linens. Okay? So again, 62. So 6 washcloths and 2 towels. So this is 3 washcloths, 4 washcloths, 5 and 6. Okay? And then 2 towels. And again, you just want to make sure that when you get your linens, nothing touches you, okay? If you have to make multiple trips, you get to make multiple trips, okay? Don't forget, with a partial bed bath, you also have to get a patient gown, okay? So just think that when you're giving your patient a bath, okay, think about how you would get a bath. You always put clean clothes on after you're done, okay? So we're just going to make this a little bit neater here so we've got some extra room, because again, there is going to be quite a few things that you're going to have to mess with, okay? So you're going to have your soap and your lotion, all right? And we are also going to need a basin, okay, for your patient. So we're going to go ahead and get our water, okay? You turn on the water, go about halfway, okay? And you're going to test the water. You have to test the temperature, and then your patient has to test the temperature, okay? So Mrs. Jones, we're just going to have you test that, okay? She thinks that the temperature is just fine. You always want to go lukewarm, okay? You want to remember that elderly patient's skin is very, very thin, and it's very sensitive to different temperature fluctuations, okay? So now that you have your water in here, take your washcloths, all 6 of them, and just put them in here. They have to get wet anyways, all right? So first thing is first, you have to prep your patient, okay? So because there is no weak side that is specified on your patient, you can take the gown off any way that you want, okay? Again, you just want to maintain that they are a human being, and even though they are a mannequin, you still want to make sure that you're providing privacy to them, okay? Just because you are doing a partial bed bath doesn't give you a free ticket to expose your patient any time that you want, okay? So we're just going to go ahead and support, okay? Gown comes off. All right. There we are. And then this is going to go right in your dirty linen. Okay. And we're going to go ahead and place the first towel, okay, right across the breast area. Now what I like to do is I like to fold this up into a rather thin towel, I guess you can say. Alright. And that's going to go right across the breast area. And it's also going to pretty much remind you that you're not to wash this area, okay? So you're going to go and place it right over the breast area, okay? Don't do this, but just to show you guys, okay, this is what it looks like, okay? You're going to clean the top and then the bottom area, okay? You're going to stay away from the breasts, all right? So just so that you guys have a visual, that's how it is, okay? Next towel is going to go right underneath the arm, okay? What I recommend is opening it up all the way, because your main goal here is to keep the bed nice and dry, okay? And you want to go past the fingertips with your towel, so from the shoulder, all right, all the way down past the fingertips. So open this towel all the way up, okay? So now Mrs. Jones is ready to have her bed bath, okay? First towel is going to be just water, okay? Just water. And what I recommend is when you fold this towel, okay, this washcloth into a 4 square, okay, the way that you're going to hold it is to where you can peel surfaces, okay? So every time that you wipe the patient's face, there is a clean surface, okay? Now, the way that you're going to do this, okay, the canvas is going to be where you're going to start from the inner part of the nose over the eye to the temple. So that'll be my first swipe with just water, okay? And then I'm going to peel, okay? So it gives me a fresh side. My second one, I'm just going to copy it on the other side. So from the inner part of the nose over to the temple, and then peel. Now this is my third swipe. Temple to chin. I'm going to peel. This is now my fourth. Temple to chin. And then the back side of this washcloth is going to be across the forehead. Okay? Now you don't have to necessarily maintain this exactness on the canvas of the face. Okay? But I find that it's a lot easier if you pair things together, okay? But some people do like to do one side of the face and then the other. It's just whatever you're comfortable with, okay? So now, I'm keeping this washcloth in my hand, okay? You can also put it on the chucks if you'd like, but I feel that this keeps you from forgetting that you have to reuse this washcloth, okay? So now what I'm gonna do is I've washed her face, so now I'm just gonna pat it dry. Okay. Again, using a towel that's right here and accessible. Okay. So now I'm going to place soap on this. Okay. So we're going to reuse this first towel, or this first washcloth. Okay. We're going to soap it up, and now you're just going to use it like a regular washcloth that you would in the bath or shower. Okay. So shoulder to shoulder. Okay, I like to do at least 4 or 5 swipes. Okay, you're then going to skip this towel area because we are not going to clean there. However, you do have to place your arm right underneath the breast area to lift up and get the folds underneath. So still the same towel, okay? You want to do about 5 swipes, okay? And then you are going to go down to the belly button or abdomen area, no further, okay? So now that's soaped up, okay? So you have to soap the area, then you have to rinse the area, then you have to dry the area, okay? So this is just water, gonna wring it out, and you're gonna repeat the exact same steps that you just did, okay, to rinse off the soap, okay? So you're gonna put your arm here again, pull up and get underneath that fold in the breast area, okay, right over the abdomen and belly button area, and now that soap is off, okay? So again, this towel's in the perfect proximity to do the drying, okay? And remember, you're always patting dry, okay? Always patting dry. And if you noticed, I haven't uncovered her yet, okay? I haven't exposed anything, so my patient's feeling pretty comfortable so far, all right? So now that you're dry, we're gonna do the arm. So soap it, rinse it, dry it. It's exactly how we're gonna do this skill here. So we need to soap it, okay? Again, we're just using it like a regular washcloth. We're not peeling any more sides or anything. That was just for the face, okay? So I'm going to go ahead and start at the hand, okay? Work my way up to the armpit. Make sure that you clean the armpit area, okay? Once that is done, that goes in the dirty linen. We got to wash, okay? So again, hands, fingers, and then the armpit, okay? So we soaked it, rinsed it, excuse me, now we have to dry. You're always patting dry. Okay. So now our patient's arm is dry. Okay. Next, we are then going to apply the new gown, okay? So right up and over the top of the sheets, okay? We're going to place this on the mannequin, and we will dress her, okay? Now there are different areas that you can put the gown on your mannequin, okay? So I don't want you to think that just this exact way is how you have to do it. For sure, you can do it even later in this process, but I just recommend doing it now. It's just a lot easier. Okay, so now we have her gown on. Okay, now the towel that was covering her breast area, you can go ahead and take that out. Okay, so we don't need it anymore. Okay, you're going to go over to your hamper. Make sure you always walk everything over to the hamper. Don't basketball shoot or throw it in there at a distance. Okay. Now we're going to hold the top of the gown here, and we're going to pull the sheet down. Okay. And then recover our patient. All right. Now we have one other area that we have to do, and that's going to be the back. Okay. So with the mannequin, you always want to go what I call neck and knees. Okay. Get underneath the knees, get to the neck, okay? And then 1, 2, and 3, and you're just going to turn and roll your patient, okay? And make sure that you get them into an area that they're not going to roll back on you. And sometimes that's not always easy to do, okay? So it's good to practice with the mannequin if you have one available. Now the arm towel now gets tucked underneath the back. Okay. And the only area that you really should see of your patient is just the neck and the back. Okay? So we got to soap it. Okay? So soaping. Alright, we're just going to go from the back of the neck just all the way to the top of the top of the butt there. Okay? So this is soaped, rinsed. You're just repeating the exact same steps you just did. And now you're going to dry. Okay? So we're just patting dry. Once that is done, there's one item that we haven't used that's just been kind of chilling out on our table here. This is going to be your lotion. Okay? We're just going to do a small amount. I would say about a pea-sized amount. You want to warm up the lotion in your hands. And then you're going to go ahead and rub your patient's back, okay? Put the lotion on. And then you are going to pat the excess lotion off. Okay? This is what's going to allow you to now take out your second towel, okay? And walking it over, putting it in the hamper. And this is the perfect place now to go ahead and tie the gown. Okay, so you've tied the gown. And now, again, just like I had said before, neck and knees. Okay, so get your hands under the knees of your patient, the bend in the knees, and the neck. 1, 2, and 3. Okay, want to make sure that your patient is comfortable. Alright, so now we're going to take care of our supplies. You always have to clean up. So don't forget that your supplies, whatever you've taken, you have to put back. Okay? So now we have water in here. We're going to turn this on. Okay? We're going to rinse 3 times. Okay? In your book, it does say a minimum of 2. Okay? So we're just going to go ahead and rinse with water. That's 2 and 3. I always like to make sure it's super clean. Okay? We're going to get our paper towels. Dry this out good. You don't want any wetness, no mold, or nothing to grow in here. Okay, now we're going to get our chucks, and we're going to discard that in the trash. Okay, and now if you want to straighten the bed out for the patient, make sure that they look good, they feel comfortable. Okay, they're clean. All right, most of all. All right. So Mrs. Jones, is there anything else I can do for you? She replies no, she's good. Now, with the call bell, just go ahead and make sure that you either tuck it underneath the arm of the mannequin or somewhere in the vicinity of their hand, okay? try not to let it fall on the floor. Okay? So now we're going to leave. We're going to open the curtain. Hand hygiene. Review our skill. Everything looks good. I tell the evaluator, I'm done with this skill.